It's the GX94 Airwaves for Health Radiothon. Ross Fisher with the Health Foundation of East Central Saskatchewan is with us right now. Ross, the Health Foundation does a lot of different initiatives that no other health foundation in the province take on.
I'm very fortunate that I have a strong board who are prepared to do things a little unconventionally. There are no other foundations that have partnerships with their local college like we do with Suncrest College. We are building a childcare center, and nobody else is doing that in the province. We've done quite a number of firsts over the years, but we're only able to do that because when we develop a good idea after talking to some of the folks in the hospital or at the college, and we take it to people, the community supports it. So we really only do things that the community wants us to do.
When people say, why do we have to give our money? Why doesn't the government just give the money? What's your answer to that one?
I think we've all seen over the last number of years that government money is somewhat tight, if you will. So I would say that for most of the things that we do in healthcare, if we want to improve or enhance the services, it's up to us to find the capital dollars to buy the equipment or to make the renovations that are necessary to expand or enhance services. The government will pay the staff costs. But if we're going to actually put in a new service, like when we put in the CT scan, we raised the money for that. When we wanted to do digital mammography and not conventional mammography, we had to raise the money for that. The government pays the staff costs, and of course, that's the more significant cost over time because that continues and continues. But for anything that we want to do that is a growth, by and large, over the last, at least a half a dozen, 10 years, we have to raise the money to put it in place and get it started.
So you don't work for the Saskatchewan Health Authority. You don't answer to them. You work with the government, but you don't work for the government. And you answer to the people who are making the donations, like everybody who's listening to this right now.
Yes, that's exactly a good summary. We are responsible to the people who fund the work that we do to do with the donations they give us, as they ask us to. By and large, we do that very efficiently. We are probably the most efficient of foundations in the province. Our cost to raise a dollar is, we keep our operating costs at less than 10% or around 10%, and that's considered very efficient across the country.
1-800-636-3243. GX94 Airwaves for Health Radiothon.